all those who remember Duncan, many years ago we did establish the Duncan Gordon Award in his honor for what we felt was as decided by the editorial committee as the most influential publication of that year. It goes back 2 years delay because we do look at citations, but it's not the only decision that we make. So this year, it is apropos of what we went through with COVID, and although COVID hasn't gone away, the epidemic has miraculously disappeared. So, which is we were lucky about that. That's why nobody's wearing a mask, and we're all here tonight as opposed to in other years. So I want to thank you for showing up in a crowd of and if it is a super spreader, it is again not my fault. So that's enough. Anyway, this year's winner is entitled "The Risk of Severe COVID-19 Infections in Patients with Inflammatory Rheumatic Diseases." It's a pleasure, and please, it's Javier Bachiller-Corral. How was that?
Yeah, that's right.
All right. Pleasure.
Thank you very much, Dr. Zimmerman. For me, it's a great honor to receive this award. Well, sorry, I'm a little nervous. Well, it's an honor for me and for all my colleagues to receive this award. No? I received it on behalf of all the authors of this paper. As you know, at the beginning of the pandemic, there was no knowledge, scientific knowledge about the effect of COVID-19 on the rheumatic diseases, and also the effect of the immunosuppressive treatment on the evolution of the infection. So at the moment, all the information, all the papers, all the publications were very valuable for the medical community. We are working in Spain, Madrid, and at the beginning, during the first 3 months of the pandemic, Madrid was one of the first areas where COVID-19 spread rapidly. So we have a lot of patients in that moment, and we could analyze our patients, analyze our data, and communicate this result to the rheumatologist community. In that moment, we find that some disease, lupus, vasculitis, have an increased risk for a severe COVID-19, and especially patients on treatment with rituximab. So we communicate these results, and we all are very glad that this work, the results of this work, along with many other works, could help to a better treatment, to a better care of the rheumatic patients. I want to thank all my colleagues, all the co-authors of this paper that contributed that moment for the publication. And I want also to thank the editorial committee of the Journal of Rheumatology for rapidly reviewing and accepting this paper so it could be communicated to the rheumatologist community as soon as possible. So thank you very much. It's an honor for me. And
now I can give it to you.
Okay, thank you.